Thank you for staying. I know it's been a wonderful but long 3 days. My name's Margo Brewer and I'm responsible for the Interprofessional Education program in the Faculty of Health Sciences at Curtin, which has revolutionised the way we prepare health professionals at our university. Just a little background, Curtin University is the largest university in Western Australia, and you can see some of the statistics there. I work within the Faculty of Health Sciences. We have 10,000 students representing 24 different professions, organised into the 7 schools that you see at the bottom of this slide. I just want to situate this interprofessional education program, which we started in 2009. The driver for this, there are a number of key bodies, but one of those is the World Health Organization, who developed this framework, published in 2010, in recognition that we are currently not meeting the demands in the health system, and we are certainly not going to meet them into the future. And interprofessional education is a key strategy in trying to improve the workforce's readiness to address our health needs. So what is interprofessional education? It's really about breaking down the silos in the preparation of health professionals so they learn a lot more about each other and have the collaborative practice capabilities to deliver much better health outcomes. We developed a very simple vision back in 2009 for all of our students, that they would be able to demonstrate what you can see on the framework image here. Very client-centred services that were safe and of high quality, by undertaking effective collaborative practice. We undertook significant benchmarking, both informal and formal, throughout this process. I won't address the formal benchmarking other than to say it was a very thorough methodology for all the teaching, learning, research activities in our faculty. But I also undertook frequent visits, consultations via all sorts of means with some key organisations who were certainly leading this space in interprofessional education. Just to give you a demonstration, it's a very complex program, but I'm going to highlight it by talking to you about the first student training ward which we developed, the very first of its kind in the Southern Hemisphere. The thing that's different about the student training ward is the students actually run the ward. They deliver the services as an interprofessional team under the supervision of qualified staff. So the process that we undertook was about an extensive literature review, making sure we were very clear on who was doing best practice and what the benefits were for everybody. I then went to visit 2 universities in Sweden and also St George's University in London, who I've identified from the literature and the reports available were the leaders in this field. I won't walk you through the next stages other than to say everything was linked to the strategic plan of the university and the faculty. We very much followed our faculty's quality framework, and made sure we had steering groups for this and every other initiative with representatives from patients, carers, industry staff, faculty staff and our students. And frequent executive briefings were undertaken to ensure that we could get the funding for this. And you can see the other stages that we've engaged in there. So how do we know that what we're doing in this training ward is best practice? We have undertaken significant stakeholder engagement in the evidence gathering, and you can see some of the things that we have looked at here, and in particular the most important things to us are the practice and patient outcomes and also the organisational outcomes. I'll share briefly with you the impact for our students. Our students are reporting that this is the best learning experience they have had in their entire training, and they've learned more in these 2 weeks than they have in all of their other placements. They've changed the choice of employment. Our retention of students in their faculty is up, and they really understand safety and quality. The patients, this is just an extract from the student training ward. They are highly satisfied with the services they're receiving. In fact, as patients are getting readmitted into the hospital, they're asking to go onto the student ward rather than the staff-run section of the hospital ward. In terms of staff, the staff both at the university and in industry find this a very beneficial experience for the students and feel that they're much more work ready and that they're adding value into the care of the patients in their organisation. There's been significant impacts on the organisation for both the university and our industry partners. We've very much changed the way the university does business. So there's a great deal of collaboration between all 4 faculties in our university in education, practice and research. So we have students from humanities, from film and television, going on the placements with our students to film the journey. We have students from science and engineering joining health science students and looking at equipment, and we also have students from education joining us. We've had a significant increase in our workplace learning. So we've replicated this training ward in multiple sites, in 6 primary schools, in several aged care facilities, in an orphanage in India, in a rural hospital in China, and we have 22 partners that we work with in this. We've also changed the way students are supervised. Traditionally, it's very much a one-to-one model of supervision, ties up a lot of health professionals' resources and is very expensive. We now engage in remote supervision via Skype. We've provided iPads to each of our industry partners, and we've also changed the ratios so that there's a greater number of students to staff ratio, but as you can see in the training ward, we have not had, in fact, patient outcomes have improved and their satisfaction is great. We've also changed practice with our competitors. Every university in Western Australia students are invited to be involved in the training ward in our other programs. And we're currently conducting research with 11 universities throughout Australia. Our industry partners have certainly increased the number of patients that they're able to service because they have a low-cost additional workforce, our students. They're very competent. The staff are also learning about collaborative practice from the students. We thought students would learn from industry, but in fact industry is learning from our students and they're driving a whole cultural shift in practice. And the research into practice is also sped up, as in the research that we're doing is taking place in the organisation with our students and with staff. So in the student training ward, we developed a clinical handover tool to improve the safety and quality of handover. It's been adopted by an entire health service in our state. And they're currently conducting research on ward communication where the patients actually critique the medical consultant and the students' ward rounds. Again, this is changing practice in our health service. We are now seen as leaders in best practice internationally. I co-chair a community of practice so that we can share what we've learned with others. And this is an Australasian community of practice with representatives from every state, university and industry. We hold an annual conference that more than 250 delegates come to, where we all share our practice. And I've been invited to consult with a number of organisations in Australia and internationally. The ones that you see highlighted in gold have now or are in the process of running a student training ward based on the sharing of the practice of what we adapted from others. In terms of benchmarking, some evidence that what we're doing is best practice is we've received over $9 million now in federal government funding, and we have won several awards around best practice and innovation in teaching and learning. This is absolutely seen as the greatest innovation in health education in some years. We've also published extensively in the literature. This is just some of the most recent publications and presented at more than 20 international and national conferences and learned a lot of lessons along the way. We have focused a lot on people, that's what health professionals do, but we did need to increase our focus on the processes to get the processes right, to make sure what we were doing was of great quality but also replicable. We've had to break down the silos within the organisation to get that great vertical and horizontal collaboration and sharing, and it's taken fantastic leadership and a very clear vision and framework. We continue to explore the non-health sector. I'm really appreciating learning from business, and we need to keep benchmarking to identify the gaps that we still have to fill those. Our strategic plans really need simplifying, and I've learned that from this conference. And we need to increase the prioritisation of our projects based on the benefits of those, and continue to explore the use of technologies to share our best practice. Thank you very much.